Assalamualaikum ma'am. I am Motalib Johanah. Today I'm going to perform the assessment of the neck. Assessment of the neck involves a physical examination of the neck and surrounding structure to evaluate for any abnormalities such as swelling, lymphadenopathy, thyroid dysfunction, or neck pain. This includes palpation of the lymph nodes, thyroid gland, and assessment of range of motion and muscle strength. The purpose of this is to evaluate the structure of the neck, including lymph nodes, thyroid glands, and muscle, to identify any signs of infections, inflammation, or growths. To assess for cervical spine issues and muscle strain, to detect signs of systemic conditions such as thyroid disorders, infection, or malignancies. Equipment, gloves for hygiene during palpation, especially of lymph nodes and thyroid, pen light or flashlight to aid in visual inspection of the neck, a stethoscope for auscultating the thyroid if needed to check for breath or other wound sounds, measuring tape to measure the size of any abnormalities. Patient comfort. Ensure the patient is comfortable and relaxed during the examination, as the neck is a sensitive area to touch. History. Obtain information on symptoms such as pain, swelling, difficulty swallowing. Ask about previous neck surgeries, history of thyroid issues or recent infection. Posture. Have the patient sit upright with their head in a neutral position for better access to the neck structure. Cultural sensitivity. Be mindful of the patient comfort and any cultural beliefs regarding neck or throat examination, especially when dealing with potential thyroid or lymphatic issues. Systemic consideration. Keep in mind that conditions such as infections, thyroid disorders, or malignancies can manifest in the neck. Infection of the neck. Symmetry. Note in the neck is symmetry or if there is any visible swelling or distortion, visible muscle or swelling. Look for any abnormal lumps, bulges, or swelling, especially in the thyroid region or lymph nodes areas. Skin changes. Look for any redness, rashes, brushing, or scars that might indicate underlying issues. Palpation of the lymph nodes. Location. Palpate for lymph nodes in the following areas: pre-auricular and post-auricular, submandibular and submental, cervical, supravicular. Size and consistency. Not any enlarged, tender, or firm lymph nodes. Document whether they are movable, fixed, or hard. Tenderness. Record if any nodes are tender upon palpation, which could indicate infection or inflammation. Shape and borders. Lymph nodes should be round, smooth, not irregular. Irregular nodes may suggest malignancy. Palpation of the thyroid. Size and symmetry. Palpate the thyroid gland for any enlargement or nodules. The thyroid should be smooth, non-tender, and without any obvious lumps. Consistency. The thyroid should feel soft and pliable. A firm thyroid could indicate thyroid disease. Tenderness. Tenderness could indicate infection or inflammation of the thyroid. Breath. Auscultate the thyroid area for any breath, which can indicate hyperthyroidism. Range of motion. As the patient turn their head to each side and tilt their chin up and down to assess the range of motion of the cervical spine. Note any limitations in movement or pain during motion, which could indicate musculoskeletal or neurological issues. Palpation of the cervical spine. Gently palpate the cervical spine for any tenderness, stiffness, or deformities that may suggest an injury or condition. The cervical spondylosis or muscle strain. Trachea and jugular vein. Trachea position. Assess the midline position of the trachea. Deviation from the midline can indicate a serious condition such as pneumothorax or large mass. Jugular vein distension. Observe for distension of the jugular veins, which can suggest heart failure or increase in intracranial pressure. Thyroid function. Hyperthyroidism. Symptoms may include weight loss, heat intolerance, increased sweating, tremors, or rapid heart rate. Hypothyroidism. Symptoms may include weight gain, cold intolerance, dry skin, constipation, or fatigue. Good morning, sir. I am Johanna, your student nurse. I will be assessing your neck today. So, next, inspect the neck muscle and look condition of the skin. Note for any scars, abnormal swelling, and masses to make sure that neck muscle are symmetrical and the skin are intact. So, place the palm of your hand against the client's right cheek and tell him move his head against the resistance of your hand to assess the muscle strength of the neck. And repeat it to the opposite side. Instruct the client to move his head through the entire range of motion, his shoulders against your arms while he is sitting to assess for proper functioning of the neck muscle in the spinal accessory nerve. Dito pa. Yun saya. 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 Next is locate the lymph nodes for size, shape, symmetry, mobility, and tenderness, and palpate them with your finger pads while moving in a gentle rotating motion. Okay. Next is palpate the trachea by placing one finger along one side of the trachea and neck for symmetry for deviation between its two sides to determine any deviation or abnormal of the trachea. Next is palpate the trachea by standing behind the patient and put your hands around his neck with the fingers of both hands over the lower trachea. So next is stand behind the client and ask him to bend his head slightly forward into the left. Place your hands around the client's neck with the fingertips on the lower half of the neck over the trachea. Ask the client to swallow a sip water and feel the thyroid nodes as it rises up. Repeat it to the other side. Next is stand in front of the client and ask the client to slightly flex his neck to the left. Place hands on the neck and apply gentle pressure on the exposed side of the trachea while palpating the other side as the client swallows a sip of water. Repeat it to the other side. If the thyroid gland is enlarged or there's a mass, auscultate with the bell of the stethoscope over the carotid arteries and the thyroid area for a broid. That's all.